All right. Hi, everyone. Thank you for joining Stop TB Canada's national call. My name is Lee Raithby. I'm a Policy and Advocacy Officer at Results Canada, where my work focuses on tuberculosis. And in this role, I'm also a member of Stop TB Canada's Secretariat team. So feel free to introduce yourself in the chat so we have a better sense of who's on the call. But just for some context, these calls continue to happen every couple months just to remain connected with everyone based in Canada who's working on TB. And we hope that these calls are informative for you, and you also feel that they are open spaces to share your work, your thoughts, and coordinate our efforts. So in terms of the agenda for today, as usual for these calls, we start with a brief update from Stop TB Canada before passing it over to our guest speakers. So today we have our partners from One, who will dive into our current campaign focusing on the Global Fund to fight AIDS, tuberculosis, and malaria. There will be some time for questions at the end, and then we'll all take a simple action together to collectively make an impact in this campaign. But before we get into our current campaign, I did just want to take a moment to report back on some recent developments from Stop TB Canada. So I would encourage you all to take a look at Stop TB Canada's second annual report, which reports our impact from April 2021 to March 2022. And just quickly, some of the highlights from this past year include the establishment of our second cohort of the steering committee. And we're really grateful to have some new members joining alongside some others who have been with us since we took on the reinvigoration of the Stop TB Canada network back in 2020. And the steering committee is made up of practitioners, researchers, advocates, survivors based in Canada who all bring a diverse expertise and skills to help guide the network as we advocate for TB elimination here at home and then also abroad. So for those of you who are interested in increasing your engagement with the network, applications for the next cohort of the steering committee will go out in November of this year for the following year. And in the meantime, feel free to join our directory on our website, which I think we can share in the chat as well. The annual report also outlines the reach of our communications channels, including our Twitter account and a monthly newsletter. So if you're not following us there yet through those channels, you can click the link in the chat to learn how to stay connected with us. And finally, the bulk of the annual report showcases the impact that the network has had over the year, including raising awareness about TB, promoting policy action, and mobilizing communities affected by TB. One project that may be particularly interesting or useful is the Canadian Tuberculosis Tracker that we launched on World TB Day back in March of this year. So this tool was created to provide transparent tracking of progress towards domestic and global TB elimination targets to which Canada has committed to, and hold policymakers accountable to these goals. So we'll be continuously updating this tracker, so feel free to check it out whenever you're curious about how Canada is holding up to its commitments to end TB. So I would encourage you to check out our annual report to learn more about the amazing work of the network this year, and I look forward to working with all of you and having an even greater impact this year, including through our current campaign in support of the Global Fund to fight AIDS, tuberculosis, and malaria. So I'll just provide a brief introduction before passing it over to our partners at One. But the Global Fund, for those of you who are not aware, is a global partnership designed to accelerate the end of AIDS, tuberculosis, and malaria as epidemics. It was created in 2002 in an act of global solidarity and leadership to fight what were then the deadliest pandemics confronting humanity. Over the 20 years that followed, this partnership has invested more than $53 billion US, saving 44 million lives and reducing the combined death rate from the three diseases by more than half in the countries in which it invests. The Global Fund is also the largest funder of TB programs internationally and therefore plays a massive role in the quest to end TB. Canada has been a longtime supporter of the Global Fund and hosted the 5th Replenishment Conference back in 2016 in Montreal. So Stop TB Canada is currently working alongside our partners, including one from all across the country, to ensure that Canada steps up in support of the Global Fund's 7th replenishment that's happening this year. So we're joined by our partners, Justin McCauley and Minerva Sadler-Gray from One, who will dive into the specifics of this campaign, including why this replenishment is so critical for the quest to end TB. And there will be time for questions at the end, like I mentioned before, but feel free to use the chat throughout the presentation if you have a question at any point. So Justin and Minerva, I'll just pass it over to you to introduce yourselves and dive into the Global Fund campaign.
Thank you so much, Leanne. Our friends at Results, Robin and Chris and others, and also at Stop TB Canada, thank you so much for having us today. And we're excited to engage with your community. As you mentioned, my name is Minerva Sadler-Gray, and I lead partnerships and engagement for One. I'm located in Toronto. And my colleague, Justin, I'll just flip over to him to introduce himself.
Hello, everyone. I am Justin McCauley. I work with Minerva at One, and as Lee mentioned, One Results and many other organizations work together to raise the awareness and advocate on behalf of the Global Fund every 3 years. So we're happy to share what we've been up to date this year and also what's coming down the pipeline. So can someone just confirm that you can see our presentation? Let's Talk Global Fund. Fantastic.
Yes.
Thank you, Petra. As many of you already know, the fight against HIV, TB, and malaria was the great unsung success story of this century. Scientists, doctors, health workers, activists, donors, and governments all came together to tackle this preventable disease. And it was working. We had given ourselves a real shot at ending the 3 biggest killers in human history for good. But then the pandemic struck, and another disease demanded our attention and resources, and we've let these killers regain the initiative. Failing to stem that tide would be the worst possible legacy from the pandemic. We owe it to all of those who have taken us this far, to all of those who have died, and all of those who don't need to die for us to finish the job. This year, the Global Fund is asking the global community for $18 billion. And we'll get into the details of that and why that figure in a few slides. But essentially, it is the funding gap required to get us from where we are today, battling the pandemic and these diseases, to where we can effectively end TB as well as AIDS and malaria by 2030. Though all member states of the World Health Organization and the UN have committed to ending the TB epidemic by 2030, which is the SDG goal number 3, we need immediate action in order to get there. COVID-19 has unfortunately replaced TB, tragically, not unfortunately, as the #1 killer and cause of death from a single infectious agent. That being said, 1.5 million people died from TB last year alone around the world, including over 200,000 HIV positive people, the first year-on-year increase since 2005. As you all know already, we can still do this. We have the tools, we have the knowledge, we just need the political will. So that's where One Results and organizations like Stop TB can really use our voice to make this be one of the greatest accomplishments in human history, or one of the greatest missed opportunities. So our call to the government right now is to make the right decision. Let's fight for what counts, and let's finish the fight against TB, AIDS, and malaria.
Thanks so much, Justin. So let's step back a little bit just to put a little bit more meat in what we're talking about today. In 2019, the Global Fund 6 replenishment raised more than 16 billion US dollars to fight HIV, tuberculosis, and malaria. Now, 3 years later, the world has changed significantly. Justin, I'm going to ask you to stop sharing your screen just a second. I want to see everyone's faces or their screens. How many of you, and you can show me by your raising of your virtual hands, over the last 2 years have heard we're living in unprecedented times, right? Like all of us, I heard that so much. I'm trying to actively remove that word from my vocabulary now. But boy, are we indeed, right? We've all lived through a pandemic, which is still ongoing. And to put it simply, COVID-19 devastated prevention and treatment programs. And for the first time since the Global Fund's founding some 20 years ago, as Justin mentioned as well, in 2020, the world lost ground in the fight against HIV, TB, and malaria. Even more devastating, we've seen the pandemic, COVID-19, exacerbated inequities that put key populations at risk and increase barriers to key services for the most vulnerable and marginalized. And the Global Fund moved quickly to support countries to respond to COVID-19. And this is the fantastic mechanism that the Global Fund is, and how fast it moved to help countries respond to COVID-19 and its impact on these 3 diseases, repurposing and leveraging additional funding to support urgent needs and adapt programs. However, despite those efforts, the need for action to resume progress in the fight against these 3 diseases have never been greater, and the stakes could not be higher. And so this year, in the 7th replenishment, to close the gaps and get us back on track, and to help us achieve the Sustainable Development Goal 3 target of ending AIDS, TB, and malaria as epidemics by 2030, to build stronger and more resilient health systems and strengthen capacities to prevent and prepare for future pandemics, because those are coming, the Global Fund needs to raise, as Justin mentioned, at least $18 billion to distribute over the next 3-year cycle. So yes, we're talking about an increase of 30% in investment, an increase from what the previous cycle was. But just imagine if your salary remained the same over the next several years while the cost of living continues to increase. We would not be able to take care of our families, right? So a similar mindset perhaps can be applied to global health resources. The investment must match the needs, or we will fail in our efforts and people will die. So we're requesting a scale of investment which will help the Global Fund to save 20 million lives, reduce the death toll across the 3 diseases, and avert more than 400 million infections or cases. One of the important notes to keep in mind today is that the Global Fund, as Lee mentioned at the top of this, is an existing funding mechanism with a proven track record and credibility. It produces results. And as you heard as well earlier, we're talking about results that equate to saving 44 million lives over the last 20 years and reducing the combined death rate from HIV, TB, and malaria by more than half in the countries where the fund invests. And behind each of these lives that have been saved is a human story, as you can imagine, right? Lives of parents who care for their children, and employers and workers that build thriving communities, or neighbors and friends who contribute to their communities, and the list goes on. So in addition to saving 20 million lives that we're projecting and reducing the death toll across these 3 diseases and averting more infections, millions of infections, an investment of $18 billion will, one, accelerate progress towards this sustainable development goal and universal health coverage. It will strengthen health systems for resilience, sustainability, and pandemic preparedness, which in turn build resilient community systems that both support effective responses now and create the foundation for responding to future health challenges. It will also support community-led programs that are the foundation for success in fighting these diseases. And equally important, it will cut the death rate from HIV, TB, and malaria by 64% and build a healthier, more equitable world. And I believe we can all raise our hands to all of these, right? Over the last few years, what we've seen is that the Global Fund has been providing more resources to countries than ever before. But the countries that are most impacted by these three diseases still face significant and growing gaps in funding their responses. So the Global Fund investment needs to rise to the challenge if we are to have any chance to finish the fight and end these three diseases by 2030. So what can Canada do? Well, through the results the Global Fund has achieved over the last 20 years and its unique ability to bring together government, civil society, technical agencies, the private sector, and also people affected by the diseases, we know and we believe that the Global Fund is our ticket to enacting the high impact actions needed to realize the world we need. And so to help the Global Fund reach its goal, civil society organizations like ONE and our friends at Results and others have come together to call on Canada, to call on the government to increase its contributions by investing 1.2 billion Canadian dollars. And yes, we are advocating for a 30% increase. It may sound like a lot, but if we measure this against the cost of human life, it's really not that significant. So this 1.2 billion ask will help countries to recover from the devastating impacts that COVID has had on these long-standing epidemics, strengthen systems for health to build healthier, more equitable, pandemic-proof worlds, which we all need to be cheering for right now as we see the converging crises that we're facing, right? Justin mentioned earlier that the pandemic diverted resources and disrupted services and overwhelmed health and community systems that are essential for effective HIV/AIDS, TB, and malaria programming. And I believe that we can all relate to this on some personal level, as if not us specifically and directly, someone we know, whether it's through long lines at healthcare clinics or the hospital or through other challenges, we've all experienced some of the aftershocks in some way. Imagine others in low and middle income countries who do not have the privileges that we do. And that's why this year, the Global Fund's 7 replenishment is so important. We must increase funding so that we can get back on track to ending these 3 diseases, saving lives, and strengthening health systems so that we can respond better in the future. And as Liv mentioned, Canada is not new to this, right? Canada has been a long-standing investor in the Global Fund since its inception, right? And has maintained a strong voice as part of the Global Fund donor community. In fact, in 2016, Canada hosted the Global Fund 5th Replenishment Conference in Montreal and played such a key role and a leadership role in achieving the goal back then, which was $14 billion. And so we are so poised to do this again. We just need to elevate our efforts just a little bit more toward that increased 30% that we're pushing for. And so through the campaigns that we have going on, in collaboration with Results and others, we know that together, not only can we fight for what counts, but we can also finish the fight to end TB, AIDS, and malaria. And so Justin will share with you some of the upcoming activities we have in support of our efforts, some of the campaigns that we're running, and how you too can get involved to help us finish this fight.
Thanks, Minerva. As Minerva mentioned, we come from this as a global organization. One in particular tries to focus efforts on raising awareness of the situation, particularly in Africa. However, the Global Fund works far beyond just Africa, and we also know that TB in particular is a disease that continues to have significance here in Canada. So I want to talk to you quickly about some of the what's coming up that the coalition is putting on over the course of our advocacy period. First of all, we have been publishing a Fight for What Counts, the Global Fund stories as a video series. Some of you have also helped us out with this particular series, and you may have seen the latest video get posted yesterday. These videos tell the story of women who are on the front lines and have experience in activism, research, and care in the TB, malaria, and AIDS battles. We want to tell their stories and make sure that that human perspective is not lost when we're talking about $1.2 billion. As Minerva said, it's a significant amount of money, but it represents human lives and human potential. If the government shortchanges that need, we are shortchanging human lives and human potential. One of the other upcoming things is a Twitter Spaces panel that we are holding on Thursday. As an organization that does focus primarily on Africa, we are trying to use our platform to share some of the information and expertise in other communities. So we are thrilled to be working with Tina, who works in Indigenous research in TB and remote communities, as well as Charity and Stop TB's very own Dr. Robin White. The Twitter Spaces is a new function in the Twitter app that you can pop in and listen to a audio-only panel that talks about issues that you care about. The link is out on social media, so if this is something that you are interested in listening into, we are more than happy to share that with you throughout this call as well. This particular weekend, we are going to be in Toronto Pride. We are going to be present on the street fair on Saturday, as well as in the parade on Sunday. There are supposed to be some other images there, but it looks like they didn't show up. We are partnering with a wide variety of other organizations as well, including the Grandmothers Advocacy Network, GRANDS, and some drag queens who come from the queer community in Toronto. They are joining forces to bring the message not just to the people of Toronto, but also to the public decision makers. The Prime Minister is going to be in attendance, and they want to make a strong statement that this is an issue that is not just within the development community. It is not an issue that just health researchers care about, but it also Canadians care about. LGBTQ Canadians care about. People from all different aspects and walks of life care about Canada doing our fair share to end these three epidemics. In addition to that, on the 20th of July in Ottawa, we are going to swarm the Hill. This is a particular event that is malaria themed. We will have mosquito mascots swarming Parliament Hill, as well as volunteers from many different organizations who will be canvassing physically on the Hill, and folks who are not based in Ottawa will also be swarming the Prime Minister's communications channels, his social media, his email accounts, with messages in support of the Global Fund and ending AIDS, TB, and malaria. This is all working up to the end of July, which is the International AIDS Conference in Montreal. Our political intelligence is that the Prime Minister will be making the Global Fund announcement here. So we want to be very visible outside of the conference grounds for one final push. We also want to highlight that the need is 1.2 billion, so that it establishes a threshold in case the government announces a smaller figure. Immediately, reporters and folks who are covering this story will remember that we were out front pushing for 1.2, and they will include that context, which is incredibly important, in the Prime Minister's announcement coverage. So that is the reaction part of this. The plans are still under development for this particular opportunity, but if you are in and around Montreal, stay tuned, because there will be some fun opportunities to lend your voice to this fight at the end of the month of July. At the end of the day, this is all about solidarity. We are different communities who care passionately about the social justice behind this, as well as the economic and global health security angles. We need to come together and use our voice to fight for what counts. If we are speaking in different communities, our voice does not get heard by public policy decision makers. If we unite and all use our voice, that's when we can really make a difference, like when we made a difference in 2019 at the last replenishment. So this is the conclusion of our little presentation. So first and foremost, thank you very much for having Minerva and I here on your call to chat with you, but we are also open to any questions that you may have. So I am going to turn it back to Lee.
Thanks, Justin and Minerva, for that really informative and also motivating presentation. I'm feeling really excited for this final month of advocacy before hopefully we're celebrating Canada's pledge at the International AIDS Conference. But yeah, we just wanted to open it up for any questions from the audience. So you can physically put your hand up, use the hand raise function, type in the chat, whatever you're most comfortable with. If you have any questions about our coalition's work so far, the Global Fund, any clarifying questions from the presentation, we're happy to take anything now, so feel free to raise your hand. And I think we have some old hands from when Minerva was engaging with the audience, but I think Robin, you have a new hand there, so I'll hand it over to you.
Yeah, hi everyone. I hope you're doing well. Joining from my balcony because, you know, otherwise I just sit at a desk all day every day. So I just wanted to flag, in addition to any questions people have, if anybody's already engaging in campaigning in support of the Global Fund 7th replenishment, it would be great to hear what you're getting up to on this call as well. And I just wanted to flag that for the TB community, getting to the $18 billion is absolutely critical. So those of you who are really engaged in the global TB space will know that within the Global Fund, they have a disease split for what percentage of their resources go to each of the 3 diseases. And there's been debates around how TB has been historically underfunded in comparison to the other 2 diseases. So this year, once we get to more than 15 billion, correct me if I'm wrong, I'm not in the details as much as I used to be, but once we get to 15 billion, 24% of those additional resources will be channeled to TB programs around the world, rather than once under the 15 billion, it's only 18%. So for us as a TB community, this is particularly really critical for us to rally behind as well. So I just wanted to share that.
Thanks, Robin. And yeah, just echoing that, if you have any plans for the Global Fund campaign, or if you're going to be at the AIDS conference, definitely let us know and we'll try to coordinate where we can. There's a question in the chat from Laura Lee Kelly. Is there Indigenous representation at any of these events?
I was just going to respond to Laura in the chat, actually. But for our Twitter space that's happening tomorrow, one of the panelists alongside Robin will be Tina Campbell, who is a TB advisor, and she works with the Northern Intertribal Health Authority, which is the only First Nation organizations of its kind in the country. So she will be bringing her voice to that conversation, talking quite a bit about cultural competency as it relates to providing support to Indigenous communities around addressing TB. So you can certainly tune in for that perspective during the conversation tomorrow.
Yeah, and I think Robin mentioned in the chat, Tina Campbell is actually our current co-chair of Stop TB Canada. So she is amazing and has a lot of great perspective on the TB epidemic here in Canada among our Indigenous communities. And then also just to add, at the International AIDS Conference, we'll also be tuning into, there is a Indigenous pre-conference. So that will be entirely focused on the burden of the 3 diseases across Indigenous communities and engaging with that community. So I think that's another opportunity to engage. And Gowrisri, I think that might be an old hand, but I'll just give you the opportunity in case it's a new one. Okay, maybe an old hand. Any other questions about our Global Fund campaign? Questions about one, if you haven't worked with them in the past or curious about their work?
Just going back to the Indigenous point as well, we can always do a better job of integrating Indigenous thoughts and perspectives into our work. One, as an organization, again, very Africa-centric, but we absolutely need to do a better job being a settler society of acknowledging the Indigenous angles to this. And I know that some of the folks on this call, especially looking at you, Petra, are working to make sure that during the Pope's visit at the end of the month as well, there is an opportunity to raise awareness that TB is very present in these communities. So we are absolutely open to finding more voices to lend to that particular cause. So I don't think I can volunteer, Petra, to get any of that feedback, but if you do know any voices that would be a good place for us to connect, you can send myself an email, and I see Petra's turned her camera on, so maybe she has some more to add, but this is one of the many areas where we're hoping to absolutely raise some awareness of the Indigenous issues at play here.
I raised my hand, but I'll just jump in since you kind of put me on the spot, Justin. But I think I wanted to raise my hand anyway, because I wanted to raise the issue that this call with a lot of our partners from Stop TB Canada is an opportunity to really hear from the domestic point of view. The Global Fund obviously is looking at countries in the South where tuberculosis and HIV and malaria are a massive burden, but that doesn't mean that there is no burden of tuberculosis here in Canada. And as Stop TB Canada network, we're looking at tuberculosis burden abroad and at home. And I think we are trying to collaborate with our partners within Canada to also put those issues of the Canadian burden a little bit forward. So what Justin was talking about, using the opportunity of where the Pope is talking with Indigenous communities to really show the access to health services and to highlight that tuberculosis is a burden of disproportionate, I can't find the right English word right now in my head, but of disproportion in comparison with the rest of Canadians is something that really should be part of reconciliation discussions. And it is a good timing. We're trying to send a message to the Pope that highlights the different angles. And so if any one of you who work in the domestic TB field is willing to bring some points forward, not just for the Pope, but more in general on how important it is to actually tackle TB also within Canada, because as Canada, we are also, of course, accountable to the Sustainable Development Goals in 2030, and any goals and anything that we have set, including the goals that we've set by 2025 to really reduce half of the burden of tuberculosis in the Indigenous population. So if any one of you is working on messages or has communication campaigns or has material that we could rely on or include or link, please, very, very welcome to hear about that. So let us know. Send it either to hello@Stop TB Canada, as Lee just put in the chat, and we'll connect with you directly. Would love to set up ways to promote the work that's happening in Canada more. Thanks for that. I could put that plug in, Justin.
And just to add to that a little bit, our session Stop TB Canada's session at the AIDS conference. So we were part of the Global Village. We'll have a booth set up for 3 days, and we really want it to be a shared space. So and focusing not only on global TB, but we want to balance that with some domestic TB messaging as well. So if you have resources that we can put on our booth, anything that you'd want us to hand out, we're definitely keen to share the space wherever it makes sense. So again, the email's in the chat, so feel free to send anything my way. And maybe I'll just do one final call for questions, and then we can take a quick action together. Okay, no worries. I'm just going to share my screen, and I think Ekta is going to post a link in the chat that is a click to tweet. So basically, now that we understand how critical the Global Fund is in the quest to TB, the importance of the 7th replenishment this year, and the need for Canadians to really call for that ambitious pledge from Canada, we hope that we can all just put out a simple tweet right now, calling on that pledge from Canada. And with Pride Month right now, and we're marching in Toronto Pride this weekend, the tweet specifically addresses the need to support the Global Fund's work in protecting the health of the LGBTQ2+ community. So please go ahead and copy and paste the link in the chat in your browser, and we can create a bit of a buzz on social media altogether. And I can just share my screen and do this alongside. So once you put the link in the chat, you should be prompted to post this tweet and let us know if you have any issues, but it should be pretty straightforward, and just tweet away. There it is there. Perfect. And I will just send a follow-up email with the recording of this call and the tweet as well. If you're not able to send it out right now, you can do it at any time. And we can share some other resources and ways that you can get involved in the Fight for What Counts campaign. But yeah, just as Robin said, we're always open to feedback or questions about Stop TB Canada as well. So you have our email. We're always happy to hear from the network. Thanks, Belinda. Great to see that you tweeted. And yeah, hopefully we'll see some more tweets coming through, and thank you all for joining us today. And for those of you in Toronto, hopefully you can join us at Toronto Pride this weekend. I'll include the registration link to march with us in the follow-up email as well. Thank you.
Thanks, everyone. Thanks, Justin and Minerva. Lee, awesome as usual.